December 2019 is the month the world began to change, and no one suspected that we would be living in a different reality in the near future. A highly infectious virus that attacks the respiratory system had just broken out in Wuhan, China. As the days went by, the novel coronavirus, also known as COVID-19, started to slowly spread across the world. And thus came government directives that were put in place to protect the citizens of the country. The government of Kenya and UN agencies through the UN Joint-devolution program had been afforded the opportunity to implement COVID-19 response interventions. The flexibility and the generosity of donors like Sweden, Finland and Italy realized $3.1 million, which enabled this strategic undertaking to help save the lives of Kenyans during this critical time.
What we did was that we realized that some money that we had already programmed for on different activities here in Kenya would not be possible to carry through due to the COVID, and which paralyzed many activities. It wasn't possible really to go through with that, or it would get delayed. So what we did was to very quickly redirect the money towards the COVID response.
Finland currently funds the UNDP coordinated Joint Deepening Devolution program. We believe that the devolution process is an important factor in the development of public services for the people of Kenya. It brings the governance of the public services closer to the rights holder, that is the people who use these services.
The funds went into sensitization of the people, acquiring and distribution of personal protective equipment, PPEs.
For us, UNDP is a key partner. We were very happy to work with UNDP because we ensured a prompt, and we assured together a prompt reprogramming of the activities, taking into account the context, the situation in the country related to this crisis that was really, as everyone knows, huge all over the world and also in Kenya.
Let me first express a sincere appreciation to our development partners, namely the governments of Finland, Sweden and Italy, that as part of their overall contribution to the Joint Devolution program supporting devolution in Kenya, which we are proudly implementing together with our sister agencies UNICEF and UN Women. And in light of the COVID-19 pandemic and the situation that has presented, those three development partners, as part of their contribution for our 2020 work plan and our 2020 priorities under the Joint Devolution program, have enabled us to reprogram $3.1 million of the $5.8 million that was allocated for 2020 to directly support the evolving needs presented by COVID-19.
And to help shoulder the burden that the healthcare workers would experience due to the weight of the pandemic. UNDP deployed 50 United Nations volunteers who had trained healthcare workers to 14 different counties across Kenya. They were sent out to serve as health specialists, clinical officers, nursing officers, and laboratory technicians for a period of 6 months.
My name is KELLEN MUCHIRA, and I'm a UNV, and I am a public health by profession. My first day as a volunteer, I was deployed to the WASH department. The WASH department is Water, Sanitation and Hygiene department. My work that day was we'll need to go to a facility that the healthcare workers have, we are having over 40 healthcare workers who've tested positive. Remember, this was in June. So healthcare workers getting sick and having numbers of 40 in one health facility was unheard of. It was the very first cases of those numbers.
When we came in, we had to do a lot of streamlining of processes to make sure truck drivers are tested in time, to to make sure their results are given. And I can say up to this moment, we have streamlined the entire process and reduced the turnaround time for testing from 5 days to exactly 24 hours.
The United Nations volunteers worked hand in hand with other hospital colleagues.
When we work in these facilities, we don't carry ourselves as like UN volunteers. We don't separate or segregate ourselves. We work as, hospital staff working in a facility. We don't have any difference with our colleagues who are working with us.
Response is a very crucial part in the fight against the COVID-19 pandemic. Every second counts.
Like at one point I used to be mocked, being told that I'm the one bringing COVID to them by wearing masks and emphasizing on sanitation, hand washing. They were like, we've been living like this for all that while, but we've never had it, and we've never seen anyone who have died from it. Why do you emphasize, or why do you force us to do it? So I had to tell them that it is not, I'm not forcing them, but I want them to adopt that culture of maintaining hand washing, good sanitation and good hygiene, and using masks as a routine, because we don't know how long this COVID-19 is going to stay, and we don't know who and when we get infected, and the repercussions or the results thereafter.
And how we've been able to do this is work in 4 main areas: enhancing communication and targeted messaging and awareness for COVID-19 in Kenya, improving the capacities at national and county level to be more responsive, looking at a very critical issue, thirdly, on the gender responsiveness to COVID, and also strengthening not only institutional capacity within the county governments, but also working directly with the Ministry of Health to provide the much needed human resources and capacity to address the pandemic.
The second and most very crucial aspect of the UN socioeconomic framework, of course, is protecting people. And herein really was the issue of social protection and, of course, providing and making sure that the basic services really continued during COVID-19. And here we are talking about essential services such as, of course, healthcare, water and sanitation, recognizing, of course, the hygiene and environmental aspects of and public health aspects of COVID-19.
One of the greatest similarities we found with most of them was their spirit of innovation. They worked to making things easier and better for everyone.
Back then we had a manual record keeping. There was no computerized system. That's when I came in. He came up with a program whereby we can analyze our results on real time. A very resourceful person who has come in handy right now when we need him most.
This is one of the innovations or creativity that we have achieved in the fight against COVID-19. This is a gasoline high pressure washer machine commonly used for at the car wash. We improvised it to help us in the spraying or disinfection of contaminated places towards fighting or reducing the spread of COVID-19 in the community.
When COVID struck, there was the question of human resource, which was a very, very critical component. In as much as the county had personnel, the COVID called for more engagement. In Mandera, we actually cancelled the entire leave of all the county staff, all health staff. They were all recalled, all those who are on leave, except those who are on maternity leave, meaning we wanted enough numbers. Even then, we still needed more because the amount of intervention that was to be mounted was very huge. So UNDP was, as one of the most reliable partners, came in and helped us and with UN volunteers who have been working at our isolation facilities and the county referral hospital, doing very, very great job.
The objective of the COVID-19 devolution program was basically one, to assist the government of Kenya to effectively and strategically respond to the COVID-19 pandemic, thereby minimizing loss of lives and human suffering, and especially for the most vulnerable part of the population.
Working as a United Nations volunteer has been an opportunity of career growth in my life that enable us to study, develop our skills, and also develop our career in line with my profession.
To be sincere, UN Volunteer, to say the truth, is the best organization that I have ever worked with.
I will first of all say you have done some great job. We say thank you to UNDP. For me, it gave me an opportunity to serve my people. I'll always cherish this moment, and I will say thanks to them.
I'd like to thank UNDP for checking on us for the last 6 months we've been on contract. The networking experience and the learning experience.
These volunteers are heroes and heroines that really deserve our collective appreciation. As we celebrated on the 5th of December, International Volunteer Day, I wanted to make sure that the world knows just how valued those 50 UN volunteers are.
Thanks to all the partners and stakeholders, Sweden, Finland, Italy, and the government of Kenya. Also to the UNDP, UNICEF, UN Women for the Joint-Devolution Program response to the COVID-19 crisis.